I tend to look more at the rotation in the hips with conjunction to the pelvic floor, still looking at hip flexion and hip extension, but the rotation of internal rotation with external or internal, if we see a lack in either one of those, that's going to play into how they're lifting, how they're running, how that pelvic floor is gripping. It may cause our field with the pelvis, like we'll talk about pronation or supination of the pelvis on the femur too with that kind of movement. I see a lot of high tone pelvic floors when we see this too. A
Mhm.
lot of tension, which could cause bladder leakage, pelvic pressure, pain with intercourse,
Mhm.
tailbone pain, all the fun things, left hip pain while running. Really looking at the control, not only just like range of motion in the hip, but what kind of control do we have in double leg and single leg movement? And then, of course, building up that faster speed. When we start to break it down, what I find like with my long distance runners is we're usually lacking some kind of range of motion in our hip, but then that plays into the pelvic floor is trying to compensate or stabilize off of that, as well as it could even be like an ankle injury because you know that whole kinetic chain is connected.
Yeah,
It affects it all. So even a foot ankle injury is going to affect what's happening up the
a
kinetic
hundred.
chain and in that
Yeah.
pelvic floor.